My name is Pete Magnuson, MD. I am the medical director of the cardiac cath lab.
I'm Dr. Eugene Moffat. I'm a cardiologist here at Enloe.
My name's Dr. Peter Wolk. I'm a cardiologist at Enloe. Been here about 34 years.
I've been a cardiologist for approximately 40 years and have been in Chico for 28 years.
I've been in Chico for 34 years, and my kids have had a great time growing up here. My practice has been very rewarding.
It's a great field. We have seen growth in the science, we've seen growth in the technology, we've seen growth in the understanding of heart disease.
Chico itself has gone from a sleepy little town to a sort of the hub of a spoken wheel kind of model where we've become a tertiary center, that is a center where other smaller hospitals in the even smaller communities around us generally send their tough cases or their acute cases. So we act as a referral center, even though we're a small city.
We've done a good job with cardiac diseases. We've decreased the incidence of various parts of the cardiac disease spectrum, but the diseases we now do treat are becoming more complex.
Cardiologists take care of a wide range of cardiac conditions from high cholesterol, high blood pressure, patients with coronary disease, valvular disease, congestive heart failure, the whole gamut of cardiac conditions.
I am amazed at the amount of disease that exists in our community and in the surrounding areas. Cardiovascular disease is obviously, it's the #1 killer. It's not going away.
Not only is the community, immediate community around us growing, the community is also aging, and the region around us is growing. In addition to all that, there's newer technology that has developed that we need to be involved with.
We only have 2 rooms to do our work. The numbers of patients that need attention has been growing every year. And when you don't have space and you're not a true emergency, you have to find the space.
Unfortunately, cardiac disease can occur in spurts. There are crises. So that general plan day is punctuated by acute patients.
When I hear that chopper come in, I'm trying to find out as much information as I can about that individual so I can sort of plan out a roadmap of what I have to do. If an acute heart attack comes along, everything stops and we make room for that STEMI because time is muscle and we have to get in there right away.
Cardiology is changing to where you need more room. You're doing procedures that are hybrid procedures where sometimes the surgeon's in there, sometimes the electrophysiologist is in there, and a cardiologist is in there, a pulmonologist is in there. So you wind up with more gadgets, more people, you need more room.
The numbers are there for us to help. We just need the tools. We have the people, we need the tools.
So with the new facility, we have extra rooms, obviously. We will go from a 2-room facility to a 4-room facility.
Once we get this, we can really attract some of the great young talent that's out there and really make our center a top center in the country.
We simply have more room. We will have much less of this problem of dual emergencies trying to squeeze into a single room and making triage decisions.
We don't have to have the same numbers that you have at the Mayo Clinic or at the Cleveland Clinic. You just have to have the right attitude, you have to have great people, and you've got to have a vision.
You should see what it's going to look like. It's really quite marvelous. It's a very comfortable lounge area. It's a very relaxing place to be.
This area that I'm sitting in right now will be filled with buttons and screens and diodes and all kinds of electronic equipment that's going to make all of us able to help the community. There is so much acute need for high-level cardiology equipment and tools in order to perform what what we perform. We just can't do it in cramped quarters, and that's really what we've been suffering with over the last decade or so.
It'll expand patient care in a lot of ways. I mean, we'll be able to do things we couldn't do before. We'll be able to attract people who can do things we couldn't do before, that we were sending somewhere else to be done, or that we're not getting done. The waiting times will go down. You know, obviously we can move people through faster if we have better equipment, better setups. But that's not, I think the major thing is the fact that we'll be able to do a more complete care of the cardiology patient.
As a regional medical center, we need to grow. We need to grow to provide the cardiac care for this community. The community involvement in Enloe Medical Center is quite historical, going back from its beginnings, and continues to this day.
There is nothing better in life than when you give and you watch something grow and you watch something that's good become great.
We're interested in people in being involved in it, and being involved in it, if they give small amounts of money, that person can be just as involved in it as someone who gives a large amount of money.
Every penny counts.
Whatever they can do to make themselves a part of Enloe's growth, we're greatly in their debt. But we need them because we can't do it just by ourselves.
The donation means that you're involved, you have ownership here.
It's the best way to go to sleep, knowing that you've done the best you can do to make something else better.